Welcome, folks. Welcome. Thanks for joining us today. I'm going to go ahead and get us started. Hello, everyone. Thank you so much for joining us today. My name is Mariana, and I'm excited to welcome all of you to the first of two webinars on transformative housing solutions and why the public health community should support root cause housing solutions versus short-term solutions. I'm coming to you from Los Angeles, California, where I am based. I'll be the facilitator for today's call, and I'll also provide a brief overview of the root cause test framework paper, our recently released resource that inspired this webinar series. I'll start by doing some housekeeping, tell you who's speaking today, give a land and labor acknowledgement, and then we'll dive into our presentations. Our goal is to share about transformative housing solutions for housing injustice and insecurity, and to provide a framework that can help the public health community assess whether proposed solutions are indeed addressing the root causes of housing injustice or merely placing a Band-Aid and continuing to uphold power imbalances. We hope that our framework allows public health leaders to see themselves as health agents of transformative change. First, next slide. First, just some quick housekeeping. We are recording today's session, and we will share the recording and presentation slides with registered participants. Our webinar today is listen only, but that means you can only hear us and we can't hear you, but it will be interactive. We're going to have a Q&A session. We welcome you to enter any questions you have throughout the webinar in the Q&A panel, which is located at the bottom menu, in the menu at the bottom of your screen. You can also opt in to closed captioning, also at the bottom of your screen in the menu bar. We encourage you all to use emojis, reactions, and responses in the chat. And just make sure you select everyone so we can all see your responses. And you can use the chat box to let us know if you're having any technical problems. Next slide, please. We have a really stellar lineup of speakers today. I'm going to be kicking us off with an overview of the root cause test framework. Then we're going to hear from Jeremiah Smith with the Memphis Tenants Union and also a leader with the Right to the City Alliance. And then finally, we're going to hear from Angela Acker of the University of Wisconsin-Madison Population Health Institute's County Health Rankings and Roadmaps. Then we're going to end with Q&A, and I'll introduce each speaker before each presentation. Next slide. Before we move into content, I want to take a moment to acknowledge the unceded lands of Indigenous peoples that we all reside on, including the Tongva territory where I reside. I invite us all to take a moment to acknowledge these communities, their past, present, and future generations, the traditional caretakers of this land. We also live and work in a country that was built on the forced labor and stolen lives of enslaved Africans. The current U.S. economy, growth and development, institutions, and culture are all directly rooted in the systems of slavery, Jim Crow, and continued racial trauma and oppression. We honor the Black people who unwillingly gave of their labor, skills, knowledge, and lives in the development of what we now know as the U.S., and also honor the legacy of the many other BIPOC ancestors who were victims of the same. At the same time, we celebrate and deeply appreciate all of their descendants who are fighting for freedom and justice across the country for all of us. Land and labor acknowledgements are a starting place, a prelude to commitment and action to support the current struggles and interests of Indigenous communities, Black communities, and all marginalized and exploited people across this land. Land back and reparations movements are working to directly address and reclaim what has been stolen. We recognize that colonialism, stolen land and labor, and racial trauma are among the foundational root causes of housing and health injustices. Next slide, please. Before we kind of go into the content, just wanted to share very briefly about Health in Partnership. We're a national nonprofit working to transform the policies and places people need to live healthy lives by increasing equity and racial justice. Through research, mobilization, advocacy, and capacity building, our vision is to bring the power of public health to movements and campaigns for a just society. So, what do we mean by root causes of housing injustice? We often discuss root causes to mean the underlying causes that shape an individual or community's conditions, including poverty, impacts of racial discrimination, public disinvestment, segregation, income inequality, corporate abuse, and white supremacy, to name a few. These root causes are often the answers to the question, but why? When we are problem solving and trying to understand what are the underlying issues that have led to many public health concerns. An example, right? When a community is experiencing poor health conditions or chronic illnesses like asthma or other respiratory diseases, as the public health community, we take action to identify what could be causing this issue, including possibly built environment conditions or other underlying issues. But we can take it a step further and look for those root causes of the community's conditions, including redlining, poverty, racism, and distribution of resources, so that we can best um, find the solutions that are going to really make the conditions better for these communities. Next slide, please. There has long been a consensus in the field that achieving public health requires addressing the social determinants of health, including housing, employment, education, climate, and more. Over time, the public health community has expanded our conception of what people require to live healthy, dignified lives, with the growing consensus that community power, self determination, and healing the wounds of white supremacy are also social determinants of health. Many in public health understand that it will take deeper work to uproot the power imbalances and systems of oppression that are the root causes of health inequities. And we're pretty good at this, right? Public health has been problem solving with root causes analysis for over a century, since early outbreaks of contagious diseases, and more recently through designing solutions for youth violence or food insecurity, for example. Yet, so much of the public health's work on housing still focuses on band aid solutions rather than addressing root causes of housing injustices. As a field, we have generally invested in temporary fixes, including housing choice vouchers, reforming single family zoning without true BIPOC community leadership and input, and tax credits for developers that continue to uphold power imbalances without addressing deeper structural causes. That said, our task is not to eliminate all housing band-aids. Short-term patches may be necessary interventions to ensure that immediate action is taken, but to really create this lasting change, public health practitioners must also leverage their power to demand solutions that fundamentally transform power imbalances and address housing and health inequities at the root. Let me be clear that we at HIP know that public health, health equity, and racial justice organizations are facing attacks which are impacting funding, integrity of programs, morale, and the ability to take risks. However, where possible, the public health community can and should take bold action and work in solidarity with community groups to meaningfully advance transformative solutions to housing injustice. This bold action can look different depending on where one is. What is bold for one organization might be different in another place. We're not saying everyone should risk their jobs and livelihood or put their institutions in jeopardy. But we are saying that we cannot fall back to inaction. We're in a moment where the very idea of protecting people is up for debate. We know that the status quo is not working, and the majority of people are hungry for major changes to their material conditions and the structural structures that influence or create these real conditions. So we have the opportunity to produce a countervision to the authoritarian right that is impacting so many of us, particularly a vision that is directly challenging the economic insecurity of the multiracial working class and lifting up those solutions that will bring tangible improvements. For those that are able to, we need to lead with this vision at all levels of our health equity work. Next slide. Oh, I think we're on the right slide, actually. And I want to get into the framework paper. We created this resource to offer a tool to help guide health organizations work on housing solutions. The root cause test is a set of 4 criteria that is designed to assess whether a given proposal or policy will help transform and shift power to meaningfully advance housing justice and ultimately move us toward a more healthy and liberated future. This tool should be used by leaders in the health field who are already engaging in or are considering ways to improve housing and health equity. It's not necessary for an intervention to meet all of these criteria, but solutions that meet at least one of the criteria can make significant progress toward achieving justice and equity. Next slide, please. So the first criteria that we name is power. We ask ourselves, does a given policy or program intervention increase the power of working class and BIPOC communities to decide the future of their families, homes, and cities? So when we're starting to really think about a policy issue or intervention, we should ask ourselves this question. And why? Because power is the most foundational, building block of health, determining access to resources, protection from harm, and our body's responses to harmful stress. When we talk about making structural changes to our housing system and addressing root causes of the housing crisis, we're really talking about redistributing power, creating a system where people have power to determine the outcomes of their lives. So if we want to systematically address power imbalances and racial inequities, that we think of as the roots of housing inequities, then our health community must pursue a bold approach to how we advance transformative solutions to keep people housed and make housing a human right. One example of a housing intervention that increases power of working class BIPOC communities is forming a tenant union, which we'll learn a little bit more later today, which tenant unions help build political power for safe, affordable housing and also fight against displacement and unjust landlord practices, and really empower communities to take action to improve their conditions. Next slide, please. The second criteria that we name is universality. So when looking at a policy or program intervention, we ask, does a given policy or program intervention ensure stable, affordable, dignified homes for all? As many of us know, research indicates that shelter is a universal human need, critical for good health and dignity. So we must ensure that everyone has a roof over their heads, especially communities most impacted by housing discrimination, insecurity, because housing should be a human right. One quick example of a housing intervention that ensures affordable housing for all is decommodified housing options, including community land trusts, public and social housing, and housing cooperatives, which are community stewarded and maintain permanent affordability. Next slide, please. The third criteria that we name is racial healing. Does a given policy or program intervention help repair and heal the harms of systemic racism? Is another question that we should ask as we're approaching or doing work in housing justice. Our housing system, via the exploitation of land, labor, neighborhoods, and homes, has caused significant harm to BIPOC communities, including their health outcomes. Housing justice requires repairing and healing the harms of racism, past and present, especially colonization and anti-Black racism. One quick example of a housing intervention that repairs the harms of systemic racism is housing and land reparations, which returns land back to BIPOC stewardship. Next slide, please. The final criteria that we name is sustainability. Does a given policy or program intervention support the collective well-being of all living things and the earth? Is another question that we should ask ourselves when doing housing interventions or supporting housing solutions. We all know climate change is a major threat to all living things and a major public health threat, causing extreme weather wildfires, environmental degradation, disease and mental health risks, food system disruptions, and also displacement and worsening housing insecurity. Homes and neighborhoods should be designed to reduce exposure to environmental and climate hazards, reduce undue environmental burdens on the working class and BIPOC communities, and protect communities against the impacts caused by climate crises. One example of a housing intervention that can support collective well-being of all living things on the planet is green social housing, which is permanently and deeply affordable and really prioritizes environmental health through building and neighborhood design for everyone. We can go to the next slide, please. So many of us in the housing ecosystem, housing and health ecosystem, use a common housing solutions framework called the 5 Ps of housing security, which was crafted in part by folks at San Mateo County Public Health Department and the Bay Area Regional Health Inequities Initiative, or BARHI. The 5 Ps are production, preservation, protection, power, and placement. This might be familiar to some folks on the call. In order to resolve acute housing challenges, we must address all the 5 Ps together. We can't just use one solution and expect the issues to be resolved. So in our paper, we apply the 4 root cause test criteria to several proposed solutions within each of the 5 Ps and make our own assessment about whether these are Band-Aid or root cause solutions. And we also include examples via links to news articles, reports, demand letters, where the health community has supported root cause housing solutions. So we want to show you that there are other folks in the public health community that are really working in solidarity and supporting these root cause solutions. The 5 Ps has been a helpful framework for navigating a very complicated crisis, but we want to expand on that framework so that we can better define whether housing interventions have long-term systems change impacts or are merely placing a short-term Band-Aid on a chronic issue. We can go to the next slide, please. Just finally, I want to point you to the root cause test worksheet, which was designed for those of you who want to reflect on the housing policy and program interventions that you currently work on or support, or in the future may want to support, and make an assessment about whether this work is shifting power and addressing the root causes of housing, or is a short-term fix that can possibly maintain power imbalances. The worksheet lists things to look for as you do a root cause analysis of a housing policy solution, including those 4 criteria, and gives examples. We hope that this tool will spark curiosity about how our public health field can make a stronger impact, and at the very least, start conversations about what can be possible beyond the realm of our more familiar health equity work. With that, I'm going to go ahead and pause and now introduce Jeremiah Smith, organizer with Memphis Tenants Union and a leader with Right to the City Alliance's Homes for All Leadership Academy. So I'll turn it over to you, Jeremiah.
Thanks, Mariana. Hey, everyone, I'm Jeremiah. I use he, him pronouns. And I'm really glad to be here with y'all today speaking on this topic, the root cause framework for public health. Not only because it brings so much clarity as a framework for thinking about the public health system, but actually it's this kind of thinking that underlies my journey to becoming a housing organizer and our collective journey as a tenants union. So I'm going to drop this website. I work with the Memphis Tenants Union. I'm a volunteer organizer there. And I'm also an educator in Mississippi. And y'all will remember when COVID began to surge in the United States, we got a glimmer of what it might look like for our government to take seriously the connection between public health and other systems like housing. And what I mean is that when COVID shut down many workplaces and the economy constricted, people who were already struggling to pay rising rents found themselves facing evictions. And it wasn't just a few. Evictions were primed to skyrocket into the tens of thousands all at once. And our federal government actually moved to address this issue by issuing an emergency eviction moratorium and creating emergency rental assistance or ERA funds. And there were ways that this didn't really address the root cause, right? The ERA funds, for example, actually constituted a massive bailout of the real estate industry, providing long term benefits to the landlords, but not the tenants. However, it was relief to renters in a way that we'd not seen from our government in a long time. And the interesting thing was that the frame that they actually used for this was that it was a public health emergency. And that in order to address the spread of COVID and to stop the spread of COVID, people actually needed to have housing. The problem in our area that I was seeing as an educator was that this moratorium and the emergency rental assistance, they weren't actually getting to the people who needed it. And that was especially true in right wing trifectas like Tennessee and Mississippi, where I live and work. And so people were still being given detainer warrants, still being called into court, and still being evicted. Renters just didn't know about the protection of the federal moratorium issued by the CDC. And they also didn't know about the emergency rental assistance and how to access it. So our group actually got started when a group of organizers, educators, and community members came together to canvass, to just knock doors and let people know about this moratorium and help them access the ERA. But we quickly discovered that there were much, much deeper issues. In Memphis, for example, there is no rental registry. So there's effectively no regulation on landlords. Anybody can be a landlord. There's no uniform inspection of their properties. There's not even a central database of who is a landlord. When tenants have issues, there's no housing court. They can only bring complaints against their landlord through code enforcement, which then lands the landlord in environmental court, where at best a tenant can expect the city to issue a fine of a couple $100s to the landlord. And so, as you'd expect, landlords, especially large corporate landlords, have taken full advantage of the situation to pad their own profits. We've talked to residents in Memphis with collapsing floors and ceilings, mold throughout their homes, second story balconies that were collapsing, rusty pipes, no hot water, and that's just to name a few of the issues. In other words, people are being forced to live in dangerous conditions and they're paying more and more in rent. In 2020 to 2021, rents in Memphis went up by an average of 19%. The next year, they went up by an average of 20%. And the next year, they went up by an average of 11%. And this is in a community where the minimum wage is still the federal minimum wage, $7.25 an hour, as it is in much of our country. And so we started to support tenants to organize unions, to use their collective power to stand up to slumlords and to demand healthy and safe housing. And that's what we've been up to for the last 4 years. I want to talk to you about one union, the Memphis Towers Tenants Union, which I think really illustrates the connection between housing and public health. Residents of Memphis Towers, which is a 300 unit HUD subsidized property, are elders and people with disabilities, and they're predominantly Black. Upwards of 95% of the building's residents have a diagnosed physical or mental health condition, and in many cases, they have multiple. The building's located in downtown Memphis on the edge of the highway that actually encloses downtown. When the city was redlined, like in many other cities, Memphis's ruling class used highways to segregate Black neighborhoods into downtown and North and South Memphis. But since then, city leaders have been redeveloping downtown, pushing out working class Black residents and gentrifying the area. This has been particularly true where Memphis Towers is, which is the medical district. In the medical district, some of the largest hospitals in the country, including St. Jude's, Le Bonheur, Regional One, University of Tennessee's Health Science Center, Methodist, and the VA hospital have all ballooned. And much of the displacement and gentrification in that area has actually come about through the Memphis Medical District Collaborative. This is a partnership between those hospitals and developers to build luxury apartments for doctors and professional staff at these hospitals. Memphis Towers is located there, and one of the reasons that tenants have fought so hard to make it a decent place to live is that it is actually one of the few places where, because of proximity, they can access the medical care that they desperately need. This is because in Memphis, our public transit system has been dramatically defunded. And so buses are not a reliable way to navigate the city. Tenants with mobility issues have to submit requests for medical transports days in advance using online forms that are difficult to navigate, especially for our elders. The transports also come at a financial cost for residents, personally or through their insurance. Often the transports are late or they never arrive and patients miss their appointments entirely. This has consequences for their care, but they can also lose access to resources because of these missed appointments. So being proximate to medical care has actually inspired this group of folks to fight to win dignified housing at Memphis Towers. And they've had to fight a $1 billion corporation, Millennia Housing, that runs this government funded housing for their own profit, for private profit. When they began organizing the union, residents were dealing with broken appliances, bed bug infestations, mold colonies in their walls and their air ducts, broken elevators. One of the most egregious and widespread issues was actually the lack of hot water. And that inspired their first campaign, where they organized and created public pressure to actually win a new boiler for the building, guaranteed hot water. But the conditions in Memphis Towers didn't just affect tenants' physical health. Tenants face harassment from the management. In some cases, property managers would intentionally spread rumors about residents, threaten them with illegal evictions, and even outright verbally assault tenants that they knew had diagnosed mental health conditions. This was to create a climate of fear in which tenants were afraid to stand up for what they deserved. Often, tenants would even be driven to self commit to psychiatric institutions for mental health treatment because of the toll of this constant harassment in their homes. And all of this is for me to try to drive home the point that when health professionals are seeing tenants from Memphis Towers show up in the hospitals and in the health system with COPD, with hypertension, suffering from schizophrenic episodes, or maybe not having followed aspects of a treatment plan, often what's actually hidden or obscured is the lack of safety, dignity, and health that's available to them in their homes. Often the exploitative housing system is exacerbating these health conditions in ways that just aren't obvious in the context of the examination room. There's three final things I want to point out. The first is that Memphis Towers tenants were able to eventually kick out their slumlord. What they did was they learned that an obscure board of appointed positions called the Health, Education, and Housing Board was giving Millennium millions of dollars in tax breaks. So the tenants were able to organize and create pressure on the board to revoke those tax breaks, and Millennium was actually forced to sell their share in the building. And although the tenants are still fighting for the housing they deserve, it was a huge win that resulted in a lot of material changes to their building. And I share that to celebrate what's possible, that I think often, particularly in areas where MAGA has so much control over our government, um, we are conditioned to think that residents and tenants can't stand up in their own power and in their own dignity and make demands on the system. And so I want to celebrate what's possible. And I say that to point out that health and housing are connected systems. In Memphis, the same boards that are subsidizing slumlords like Millennia are subsidizing hospitals and health facilities. That's not just true in Memphis, it's true in cities across the country. And so I want to agitate folks to think about how much influence the public health community could have on a board like this if it was able to make those connections between an exploitative and harmful housing system and our overlapping and compounding public health crises. To point out that these local governments are often subsidizing the slumlords who are causing public health crises. And second, and I'd be remiss if I didn't lift this up, is that in Memphis, our gravest public health threat is also related to neighborhood segregation and environmental racism. In Memphis, 95% or more of the residents in 18 different neighborhoods are Black folks. In other words, racial segregation in Memphis is alive and well. And I know that's not just true in Memphis, that's true across this nation. And these neighborhoods are suffering from extreme environmental pollution in Memphis. 38109 South Memphis has a cancer-causing Tennessee Valley Authority coal ash dump. Residents there deal with the smog and emissions from the busiest air cargo hangar in North America. And now the largest data center in the world being built by Elon Musk, which is using more than 36 methane gas turbines, spewing formaldehyde, particulate matter, and nitrogen oxide into these neighborhoods. Tennessee and Memphis have among the highest rates of asthma and COPD, and housing quality and air quality are directly associated with those conditions. The segregation of these neighborhoods and the targeting of Black communities for toxic industry is causing our public health crises. And sadly, we are not seeing in Memphis at this time, we're not seeing a lot of public health institutions showing up to fight this data center. So I want to agitate around that. And then the last thing I want to say is that to address these root causes at the scale that we really need, it's going to require us to really get at the heart of the problem, which is that landlords in this country are able to speculate on and profit off of our homes. Millions of us are subjected to rising rents, constant displacement, the threat of homelessness, just to line the pockets of fewer and fewer billionaires and shareholders. And if we really want to address the public health crisis, we have to constrain the ability of Wall Street and these billionaires to control our housing and to kick hundreds of thousands of our neighbors out of their homes and cities just so that they can profit. And so we need to fight for social housing, housing that's controlled not by corporate landlords and slumlords who never set foot in our neighborhoods, but by the people who actually live there. Right to the City Alliance, which is a national alliance of housing justice organizations fighting for homes for all, of which the union is a proud member organization, has actually launched our campaigns to fight, number one, for real rent control across this country, particularly in states like Massachusetts, New York, Colorado, Florida, and even in Tennessee, where we're preempted. And second, to fight for social housing with organizations like Poder Emma in North Carolina or the Beverly Vermont Housing Cooperative in Los Angeles, which are fighting to take housing off the speculative market and support residents to run their own housing. So I want to conclude and I want to wrap up with some calls to action. The first is to spread the word. Spread the word about this root cause analysis throughout your sector in whatever ways you're positioned to. We have to align the public health community, individuals, institutions around this framework, especially in this political moment where we're seeing a rise of the far right's project of mass displacement, mass houselessness, deregulation of the housing sector, and increased speculation on our homes by Wall Street and the financial industry. The public health impacts of this are already showing up in our communities, and we're going to need to connect these issues and align our sectors, or else housing and health conditions in our communities are just going to continue to erode. The second is just to work to organize your cut of this sector to align around housing justice fights. Much of our health infrastructure in Memphis is actually complicit in displacing people. And those folks' displacement is then later showing up downstream in our public health systems. And so I want to encourage folks to imagine what might be possible if organized communities of public health professionals demanded that public health infrastructure was responsive to the root causes and that they be responsible to patients, not just as patients, but as renters, as workers, as neighbors. And finally, I want to encourage everybody to get involved in a local housing justice organization. One of our earliest volunteer organizers in the Memphis Tenants Union is a pharmacist here in Memphis. And the perspective that she's brought to our work has helped us to be clearer about the needs of our people and to understand this connection between public health and housing. In Memphis, if you're in Memphis, get involved in the union's fight against this HEHF board, the Health Education and Housing Facilities Board, that's subsidizing slumlords in our city. Get involved in the fight against the richest man on the planet trying to build a toxic, air polluting data center that doesn't serve the community and exacerbates the climate crisis and is polluting South Memphis, is polluting Black communities. And if you're not in Memphis, if you're somewhere else, there are fights for rent control and social housing with our Right to the City partners. And I know that they would love for sharp public health professionals to join up and join that fight. And so, okay, with that, I want to appreciate everyone who's making time to come to this panel and to just engage this framework. I really feel hopeful about what this will make possible for our communities to align around fighting for a liberated future where everyone has access to safe housing, to clean air, clean water, and healing. And I feel confident that the 100+ people who are on this call are going to be part of making that happen. So thank y'all so much.
Thank you so much, Jeremiah. That was really powerful. Appreciate you sharing about the Memphis Towers Tenant Union and the amazing win there and the continued work, right? That is necessary to have better conditions and healing, like you said. And I appreciate those calls to action. There's so much work to do, and we all can do this, right? We are all agents of really bringing transformative change in our community. So really appreciate you. With that, oh, and I also just want to remind folks if there are any questions, feel free to add them to the Q&A panel. um, to kind of get us thinking and really dig in a little bit more during our Q&A session. So now I'm honored to introduce Angela Acker. Angela is the Narrative Infrastructure Team Leader with University of Wisconsin-Madison Population Health Institute's County Health Rankings and Roadmaps. Today, she's speaking on behalf of the Public Health and Community Power Coalition, an emerging national public health coalition where she is a member and advisor. Welcome, Angela. Turn it over to you.
Hello, everybody, and just keep those fire emojis going because, goodness, thank you, Jeremiah, for you and many organizers just pushing for accountability and transformation. So, yes, I'm Angela Acker. I'm the Narrative Infrastructure Team Lead at University of Wisconsin Population Health Institute. She, her pronouns. Coming to you also from Memphis, Tennessee, lands of Chickasaw. So, a lot of Memphis love today. Before I begin, I have to provide a disclosure. So the views expressed today are my own. I do not necessarily reflect the views of my organization or funder. But with that, let's go ahead and get into it and bring this home. So next slide. Um, am still trying to figure out why exactly I have to follow up after Jeremiah, my little public health nerd self. But I think that's the point. So let me talk to public health practitioners for a minute. So can we just have a little chat between you and I? So, as public health practitioners, many of us now tend to be risk averse when it comes to advocacy. In general, we'll see the line that you see on this screen, particularly think lobbying restrictions, think the current climate that we're in, and we'll cautiously and sometimes even preemptively take 20 steps back to make sure that we comply. And immediately when we have and we see terms like organizers, organizing groups, community power building organizations, and those terms come into play, alarms go up, and then we assume that it's too political. And that is understandable. Our public health field has experienced drastic funding cuts, sweeping layoffs, a laundry list of terms that some of us cannot even say anymore. And so it's natural to err on the side of caution. However, as the field of public health is threatened, the public's health is under threat too. So, in the times such as these, it is helpful to remember who we were when public health was just beginning to professionalize. So, historically, public health has been intertwined with social movements, championing transformative societal shifts. For example, I love to bring up W.B. Du Bois was both scholar and activist. One of the founders of NAACP, he was also the author of a study that detailed how biology did not predetermine Black Americans' fate, but conditions did. Specifically, social and economic conditions and racism, how it impacted Black Americans' health and well being. So, the roots of public health was born out of collaboration among advocates for people experiencing poverty, housing and environmental advocates, scientists, and physicians. And partnering with public health organizations is not in our distant memory. There are a growing number of public health organizations across this country who are expanding their work to support social movements. And so on the next slide, you'll see our wonderful logo and a beautiful picture of some of the people within that coalition. Public Health for Community Power, PH4CP, is a part of that growing number. In 2024, Health in Partnership brought together a group of non-governmental public health organizations, a few academic orgs too, to form PH4CP. The mission of the coalition is to stand in solidarity with community power building organizations and grassroots movements, channeling our expertise, be it research, analysis, or advocacy, into fights for systemic change. PH4CP is a revival of public health's legacy and connection to social movements, and by positioning public health professionals to be active allies to the pursuit of equity and justice. So we use our public health expertise to amplify the voices of those on the front lines those like Jeremiah, ensuring that health and equity is not just an ideal, but reality for all communities. So let's return to that picture for just a minute. That line that we are so hesitant to be close to. Over the last year, members of the coalition have found a myriad of ways to support power building organizations that keep to the parameters that we do have to navigate. Some organizations have been able to sign on to support letters, attend Day on the Hill events, whereas other organizations supply policy recommendations, research, narratives. Some organizations have platforms that have a large reach so they can elevate messages, stories, and solutions. The lesson here is that every organization does not have to lobby, but every organization and everybody has a role that they can play to affect change. And it's not one size fit all, but everyone has a piece that fits into this magnificent, glorious puzzle to build power, especially now. And so this applies to the role that public health has in advancing transformative housing solutions. And I will share a little bit about my own organization as an example of what we do. So, County Health Rankings and Roadmaps, or CHR&R, is a program within University of Wisconsin Population Health Institute. We believe in the future where everyone has opportunities to be healthy and to thrive. There are many factors impacting how long and how well we live, and from the opportunities we have to access affordable housing and safe places to live and to play, to opportunities to participate in decision-making processes. CHR&R is a one-stop shop at the intersection of data, tools, resources, and community. And through our assets, we aid communities to build the case of what impacts health, our role in shaping a future for all, and I do mean all, and lifting up narratives, strategies, and solutions that communities can use to take action. So it is also important to note that we are housed in a public health academic institution with lobbying restrictions. That is also a condition of our funding from RWJF. And you can pull to the next slide. So we can't lobby, but what we can do is draw connections between the conditions in which we live and how that affects how long and how well we live. We just can't tell you to support XYZ bill, but that's not our lane. Our lane is data research strategy and framing. And CHR&R has long, detailed connections between housing and health. In 2019, we released a report with data and graphics. One key message included that in communities where housing costs rise faster than local incomes, households struggle to acquire and maintain adequate shelter, often to the detriment of other social and economic factors that enable us all to be healthier. But we just don't stop with reports. We communicate these key messages like these through our communication platforms like blogs, webinars, and most recently, our In Solidarity podcast. And we disseminate information through media and through the work of our network of local, state, national public health practitioners who can champion our resources, strategies, and yes, the data. Recently, a colleague and I also had the opportunity to review and provide suggestions of a research paper around why rent control is good for health. And in that review, we were able to apply two of our key assets, narratives for health and what works for health. And so just to get through these slides really briefly, but we're building narrative power, we're shifting narrative change, a process of organizing tools that shift people to understand the world and how the world works. And so in that, helping with the research paper, we were able to frame the paper, point ways to make messages clearer, point back to values, that we want priority, also call out harmful narratives like individualism and the assumption of capitalism fixes all of our problems. On the next slide, you also see what works for health. That's a database that includes 400 evidence informed strategies that include ones like housing and organizing. So we're able to really relay out those extensive amount of up-to-date literature and research that we have around the connection between rent control and health. And so I'm going to wrap this up, and you can skip the slide on power and move straight on to our model. And so we also have a model that really talks about the connection between health and power, making power the most fundamental of them all of understanding health opportunities. And so people can build community power when they organize and act together to set agendas, to shift public discourse, influence who makes decisions, and cultivate relationships with decision makers. And that's why I see the root cause test as such a gift to the field, because it allows us to ask the question of whether or not you can go deeper in the solutions that you co create with communities. And the answer is that you can, and you can change the rules that shape our society. And when it comes to transformative housing solutions, we can work together so that everyone has a safe and affordable housing, and that we can shift power together. We can work together so that everyone thrives. And on that last slide, you see all the wonderful ways that you can learn more. countyhealthrankings.org, narrativesforhealth.org, and with the coalition, publichealthforcommunitypower.org.
Thank you so much, Angela. Appreciate all your reflections and really taking us back to the roots of public health, right? And I love that you mentioned that this coalition is a revival of that past of public health's real deep history in addressing these root causes. So super excited about the coalition's work. And I love that you mentioned we can change the rules. That is so necessary to remember, right? That we can do this work. It's going to take a lot of collaboration, really working closely with communities to make these transformative changes. So appreciate what you just shared today. And again, just wanted to really highlight that both of these groups, CHR&R, the Memphis Tenants Unions, are doing amazing work and continue to do this work in their communities and across the U.S. So this is the way that we're gonna make real change, advance housing justice and health equity for justice and liberation. So just appreciate what you all are doing. With that, we're gonna go into Q&A. So we have a few minutes to maybe take like 1 or 2 questions each. And I'll take a question from the audience and open it up to see if Angela or Jeremiah wants to maybe take this question, or I'm happy to kind of entertain it a little bit. There was a question from someone in the audience. Any thoughts on the criminalization of homelessness, and if this is connected with the increased inequities we see in housing as another way the prison industrial complex is getting more and more funding from the government to expand and build more prisons? I'm happy to read the question again, or does anybody want to touch on this one?
I mean, I'd love to touch on it maybe from the housing angle, and then I wonder, Angela, if you could offer like some context on the public health angle of it, because I feel like there's both angles to it, both in terms of this homelessness and the way it's shown up in our systems, and in terms of like the carcerality of the different systems that are. Oh, me? Did I break up for a second?
Freezing a little bit, but I think we can hear you again.
Okay, great. Just the carcerality that people are subjected to in the health system and through the health system, the way that it's designed. Yeah, I mean, we're seeing it a lot. I talked about the increase of rents. There's just increased displacement where people can't find an affordable place to stay, and where affordable housing is such a myth in the system. We're also seeing where Tennessee has passed a bill to make it illegal, that makes it illegal to camp in public spaces, which is just a targeting unhoused people. They've been doing sweeps, and I think an especially concerning thing is to see the consolidation, like in DC, what's happening with the National Guard being deployed and sweeping unhoused people into the prison system, into the prison industrial complex. Um, and so I think like just my this is not quite the question, but I want to offer it anyway. Like my sincere hope is that we can align across all of our different sectors around the fight against that consolidation of infrastructure, which is manifesting through ICE, it's manifesting through the National Guard, it's manifesting through expanding federal prisons. The Everglades Detention Center is a model that they're pursuing. I just think that like all of that we need to see the connections to, and then we need to be able to find in our local context what are the red lines that we can actually build up movement around we know they're coming. I mean, so Memphis is a majority Black city in a majority white state. It's a city where Democrats are in charge in a MAGA trifecta state. And I mean, they're already talking about invading New Orleans. I think this is kind of the template. And I think I'm certainly thinking about in Memphis how we align our movements to say we have to stop that qualitative shift, and it's connected. I hope I'm not losing the thread. It's like it's directly connected to that criminalization of unhoused people, to the criminal. I mean, and I think back, my history brain thinks back to the black codes in all the southern states where Black sharecroppers and agricultural workers were criminalized for mobility, criminalized for if they were deemed vagrant. And I just think that like we need to be very, very aware that this is like not a new thing, but it is an escalated thing. And we need to be able to talk to our people about both of those facts and then find inflection points where we can block the consolidation of that infrastructure. But yeah.
Thank you, Jeremiah. I appreciate that. Yeah, and I'll just add, oh, go ahead, Angela. Were you gonna add something?
Um, I was just, I always have the question of why. So I always go back into like inquiring, well, why is it that we're criminalizing homelessness? Why are people homeless from the jump? And it goes back to a lot what Jeremiah said, but also just like lifting up the narratives around, well, who decides who should be cared for? Who decides who should have dignity and treated justly and provide the things that they need? And how do we get to a point where we're like working together to fix the solutions and understanding that, this problem just didn't arrive here today, as Jeremiah said. But as Jeremiah was saying, like, yes, it has been exacerbated. We've seen it also in the COVID-19, the beginning stages of the COVID-19 pandemic, and how that interplay with both housing and health came right in that intersection, and understanding that you couldn't do one without the other. And so, in order to understand how to really address housing and homelessness, you can't address those issues one without the other, and you can't treat it like it's something that happens within a bubble, but it's within all of these systemic and structural issues that are just really like fighting into this to make it a storm factor. But how do we quiet that storm and make it to where everybody gets what they need and to make communities better for all?
Absolutely. Go for it. Did you want to add something?
Just want to lift up what Lacey said in the chat about these systems are deliberately debilitating for people, and then the systems create debilitation, and then they criminalize disability. And we're seeing that happening in the schools, like the intersection of schools, housing, and the public health context. Like we're seeing the way that disability is being used as an inflection point in much the same way that immigration is being used as an inflection point. And like I'm old enough to remember when terrorism was that inflection point, right? Where it was we're going to use these labels as excuses to criminalize huge swaths of people, not, and exactly what Angela was saying, like for the benefit of what? For the benefit of a tiny clique of the white ruling class in this country to consolidate more wealth and power. And I think like just that, I really appreciated you lifting up that like disability intersection, because that like homelessness is debilitating. Homelessness creates physical disabilities, creates mental health crises, exacerbates existing disabilities. And like I think as we think about these intersections of like homelessness and the public health system, it's really important to think about how are we actually getting at the root cause, and not just because often when we're just sort of atomizing it, compartmentalizing it, that leads to pathologization, right? And I see it, and I see it in my context as an educator too, where it's like when we aren't thinking about, well, what does this young person not have? What supports do they not have? Um, what supports do their families not have? And then they're coming to school and they're struggling to focus and they're struggling to read, and maybe they are developing it can exacerbate. So we see this pathologization then, and then we see states like Oklahoma that are saying that actually students with disabilities can't get a diploma anymore.
Mm.
And I just think like I was glad you lifted that up.
Thank you. Thank you. Appreciate you both. That is a very rich context and just great like conversation. Um, we have time for maybe one more question, like a rapid fire response. So I'm just going to go with, we're naming a lot of complicated intersections, right? So how do we get to the root causes in this moment? We named, the fact that public health is actually in Memphis is benefiting or part of subsidizing slumlords, right? And really, unfortunately, has a not so great role in some of this work. And, but we're also talking about like, we do this work. There are public health folks that can and have stepped in, including around criminalization of homelessness that has happened in California and Colorado, really addressing homes, not handcuffs, and, street sweeps, homeless sweeps, right? So what is necessary and possible from public health in fighting back right now and really preserving self-determination for communities? So we could maybe take 45 seconds to respond to that, and then we can wrap up.
I'll start this go round, talking to my people here. Um, so we have to be okay with asking the questions and peeling it back. We have to understand how power is at play. We have to understand who's benefiting and why. But then we also have to understand what is our role to shift power back to the hands that need it the most and those who are being impacted the most. And so that requires also some deep listening, because you go into communities and community members will tell you, we know what's going on in our communities. We know the root causes. And so sometimes it's not just like giving you the data is already there in the experiences of the community member. So we need deep listening. But then also, how do we then couple that with the things that we already do and we do well? And that's with data, that's with our research around policy recommendations. That's with us, how we shape and like form the dot connections between what's going on with conditions and how that's affecting people's well-being. And we do those things that we do well. We don't have to be an organizer. We continue to be a public health practitioner, but in support of those who are on the front lines doing this work. So we walk alongside, we accompany if we need to be in the back cheering on. But as I always say, the most important thing that anything that we can do is we just have to show up. We show up, we listen, and we show up.
Thank you, Angela. So
Again, I'm wanting the fire emoji to flash on my screen. I mean, I disagree completely with what Angela was saying, and I want to like just plus one it really. I think in our social movement infrastructure, part of what's happened with the nonprofit form, which I'm in a nonprofit and I advocate for the nonprofit form, we have to use it. It's the infrastructure that we have and we have to use it. And what happens is that our organizations don't understand their role in an ecosystem of organizations. And we as individuals struggle to understand our role in the ecosystem of individuals and organizations. And so just to like plus 1 million what Angela said, we need public health professionals who show up as public health professionals in our movements, right? And give our people that data, give our people that insight, help us understand the infrastructure that exists and doesn't exist, help us understand these policy decisions that are being made, work from the inside of these health institutions that are complicit, right? And then in that way, I think like we can build a healthy ecosystem of organizations rather than doing what frankly we see in Memphis. I've been complicit in it. I'm in Memphis, Mississippi and Memphis. I mean, we all are implicated in this of replicating work and not being in right relationship with each other across the different organizations that we're doing. And then just also plus as an educator who has thought about a lot about liberatory pedagogy, plus 1 million to what Angela said about like communities actually know what they're going through and know their own experiences. And like what I think the best like uh, political education does is to give people a framework for vocalizing and grappling with it together, rather than to say I need to teach you about public health in your community, saying you have an experience of public health in your community and I have some language and I want to see if that like resonates. And if it doesn't, like I want to give you that language to then like mold and shape in the way that makes sense in your community. And so just plus, but again, just echoing what Angela said.
Well, thank you both. This is really great. I appreciate all of your insight and reflections and the power that you guys just shared today. Really, really appreciate it. So we went over a couple minutes, but thank you all so much. I want to thank the speakers today, funders who supported this to develop this resource, and all of you who joined. We appreciate all the reactions and emojis in the chat and your responses. Please stay connected with us via our social media channels, including Blue Sky, Instagram, Facebook, and LinkedIn. And we just hope that you continue using this framework and that this workshop was a great resource for you. And we hope to see you all right in the streets. Join your community, the groups working in your community around housing justice and other issues. So just appreciate everyone today. Thanks so much again.